And now I'm going to discuss about the result of our investigator-initiated phase 2 trial of Asciminib in patients who have newly diagnosed chronic myeloid leukemia. In total, we enrolled 40 patients at the time of the data cutoff and presentation of this data set. Overall, those patients, maybe 20% of them, 18% to be specific, had high-risk disease. And those patients received Asciminib 80 milligram per day. And we had a median follow-up of 1 year so far on the study. The primary endpoint of the study was the rate of major molecular response, MMR, or a disease level by PCR less than 0.1%, which was really good. 69% of the patients did achieve MMR by 12 months of therapy. 96% of the patients achieved a complete cytogenetic response by 1 year of therapy, which is excellent. And close to the third of the patients achieved a deep molecular response by 1 year of therapy. And this is very promising because this is a surrogate for potentially treatment-free remission and treatment discontinuation down the road. Overall, treatment was well tolerated. People complained of some fatigue, had some elevation of lipase and amylase, which were overall well tolerated of grade 1 and 2. 5 patients on the study had to discontinue treatment because of side effects, 2 of them because of clinical pancreatitis, 1 of them after losing a cytogenetic response, and 2 of them because of cardiovascular toxicities, brain stroke, and cardiovascular syndrome. The cardiovascular syndrome occurred in an older patient, 72-year-older patients, and this was a grade 5 event. Other than that, patients remain so far on study with a side effects that are manageable and overall of low grade. So in summary, this interim analysis showed a major molecular response rate close to 70% by 1 year, deep molecular response close to 30% by 1 year, an overall favorable safety profile. However, some events were reported, particularly 2 cardiovascular events and 2 GI toxicities.